get going on the ground with Stephen Mbide monitoring the COVID-19 response. The conversation he's going to be having with Robina Nabanja, Honorable Robina Nabanja, who is the Minister of Health for General Duties. Over to you, Stephen Mbide.
Good morning, Richard Kanya. Yes, indeed, I'm here at Makere Kavle. I'm going to be speaking to Honorable Robina Nabanja. She's also the woman MP for Kakumiro District, but also she's, for this particular conversation, going to be talking about issues of health and the response on the COVID-19, what government is doing and what she, as the Minister in charge of General Duties, she's been able to at least accomplish for this particular period. I know she was appointed a minister on 14th December and she was sworn in on 13th January, this just 4 months. Good morning, Honorable.
Morning.
Just tell me, first of all, these 4 months that you've been in office, how's been your general reception? What have you been able to find internally within the ministry?
Morning, viewers. Like you have said, Nabanja Robina is my name. I'm a Minister of State in charge of General Duties. The 4 months in the ministry, generally, they have been challenging. Why? Because no sooner had I just been appointed than this problem of COVID came in. Remember, I had organized my plan of moving around the districts across the country.
And indeed, you've been moving around.
Yes, I have, but that would not be the speed at which I would have moved. There was some slowdown of my speed because we have to attend to other urgent issues in the ministry. Yes.
Okay. And moving around, what exactly have you been finding on the ground? I've seen you in Busia, Hoima, Chenjojo. What exactly are you finding on the ground and many other districts?
I have found a number of achievements that we have achieved as the nation and government. There are a number. One, infrastructure development. We have put in place a number of infrastructure in the country. We have also done a number of things, though there is some neglect by our health staff in some health facilities. For example, Busia, the clinical part of it was not good, but there are those that really are commendable, like Iganga, like Hoima, like Elira. I've been to those places and you really say, yes, government has done something.
Yes, government has done something, but sometimes some areas you find that, yes, in the terms of away from the nurses and medical staff have been negligent, as you were saying, but also and some facilities you really see that their condition is deplorable, the equipment is either outdated, or in some cases you see that there are some equipment that is still lacking in those facilities, and after 34 years, someone would think that at least now the picture would be better.
Oh yes, there are some facilities which have got equipment that is no longer working, like Rusia hospital, that is MASAF. We found that the X-ray has been faulty for quite some long time. We informed the ministry and they are going to put that right. They are going to be one of those hospitals that are going to receive the new equipment we are procuring right now. But we also found out that Busia Health Center 4, there was quite some bit of negligence by the in charge, and of course we also found out that health facilities have got some drugs, despite the fact that people have always been saying there are no drugs, there are no drugs. I found out that there are some drugs which can, because on that very day when I went to Busia, Red Cross Health Center 4, people were being told that there was no drugs in the facility. Then we insisted they opened the store, and the store was full of drugs.
Honorable, let's speak about this issue of the COVID-19, which is also challenging, just in your words, and the 4 months you've been in office. Looking at the government response, also want to understand from you how, of course, yes, we've had some discharges, 28 of them are now able out of hospitals, but I also want to understand from you, is the response from you, government, from you, the Minister of Health? Is it that the one that you really also have wanted? Is it the one that is satisfactory from your part? Maybe you see something that is still lacking from your part or from government. How do you gauge the response on this COVID-19?
Allow me to first of all thank the President, before anything else, for having allowed the pregnant mothers to reach hospital without going through the RDC.
There have been a hassle for many people.
I want to thank the President for having really accepted that let the pregnant mothers not go through the RDC, but go just directly to the health facilities. The response, the COVID response, I believe we have done our part. And I want to thank our response team, our task forces, the National Task Force, headed by the Prime Minister, our medical task force in the ministry, and the district task forces for the work well done. I also want to take this opportunity to thank the health staff across the country, especially those who have been at the forefront for the work well done. Uganda is one of those countries that have really done very well. This is depicted by the fact that when you look at other countries, say for example within our region, when you look at Kenya, when you look at other countries that are neighboring us, you really see that our response was the best.
The response was the best in terms of measures,
in terms of everything, because first of all, remember when this problem came, I presented a report or a statement on the floor of Parliament. And we said those who are in China, remember that time there was this cry, people wanting people to come from other category 1 countries, high-risk countries. Then we said no. If those people they are coming here, we shall put them in the quarantine. So we opened up quarantine centers, remember? First of all, we started with making them get quarantine themselves, self-quarantine in their homes. We saw that that was not working, then we changed our strategy and put them under institutional quarantine in the hotels and other institutions. And that is where we got the cases. So our strategy was, I think, the best.
Let's talk about also the health officers, those the food soldiers on duty. Their condition, had the Uganda Medical Association trying to threaten that if they are not well facilitated, many of them haven't even up to now gotten their allowances, yet they are on the duty. As government, as Minister of Health, what are you looking at this? Because if these people decide to lay down their tools of trade, this is going to be a very big problem in this case of COVID-19 response.
Like you saw other big economies, the problem came when everybody was not prepared, including big economies. The fact is, we were not prepared for COVID in the first place. Like any other economy, like any other countries, this is a pandemic. So when this problem came, we thought it was necessary that we start with the protective gears. So remember, government gave us 5 billion, and we used this 5 billion to procure protective gears. And these protective gears were, because we thought that was a priority to keep their lives. But now I want to assure our health staff that within this week they will be paid. The lists of those that are supposed to be paid came a little bit late by the concerned. But now we have everything in the ministry and they are going to be paid this week.
Okay. Let's also talk about the 62 billion that is going to the health ministry from the supplementary budget.
Yes.
How is this money going to be used, the 62 billion?
Of course, we are going to focus mostly on areas. Of course,
is it even enough?
It is not. Of course, it's not. But we are going to focus basically on areas where we are lacking.
Like?
Remember, we have a challenge of ventilators. So we think if we get this money, and of course it has come, by the way, we are going to add the number of ventilators in our respective hospitals. We are also focusing on regional hospitals because we think the regional hospitals can also help us in treatment and isolation of confirmed cases of COVID. We also put aside, we are also trying to renovate some of these mental units. We are also going to, of course, pay our staff allowances, but also focus on equipment that we lack in the hospitals. Yes.
Honorable, I also want to get your view on the issue of the money that is coming to Parliament. You're part of the Parliament Commission, and I know you're also a member of Parliament. Out there, some circles of the society, many people are not really happy with you, members of Parliament. Over the 20 billion, over the 20 million they're going to get as members of Parliament. They think that maybe instead of you getting the money, first of all, you also help me understand how, as members of Parliament, you're going to use this money. And also, they think that now that many of them are going through stress of economic times, they would think that maybe if this money, the 10 billion, was given to the task force to cater this for their relief, would be a better idea. First of all, how are you going to use this money? And also, they think it would have gone to the task force.
The fact is, I am no longer a member of the commission. I have been really so busy.
Would you have opposed this if you can?
I have been so busy, and I saw the speaker say that the commission will talk about this. I request you to refer this matter to the speaker and the commission. I'm no longer a member of the commission, and really I've taken some time without even going to Parliament because of what you know. So I am not the best person to talk about this.
But if it comes your account, would you spend?
I have not even seen the man on my account. You know, I have been a member of the commission, and even if a member of Parliament gets a pen, I see the public not happy.
Okay, what's just your word to people who are angry towards the members of Parliament over this money?
First of all, I believe that it's the speaker who will talk about this. Okay. Inside me. Let me not really.
Okay, hold on. Your last word to the viewers there.
My last word.
COVID-19 response.
My last word to the viewers. The Ministry of Health, together with the government of Uganda, is trying its best. We are trying our best. The pandemic we are trying to fight is not a simple one. It has really put most of the economies in the world on their knees. So it is not one person who can fight it. All of us have to really join the battle. The public knows what we have been telling you know what we have been telling you to do. Please distance, like you have done, 4 meters distance. Let us try to wash our hands regularly. You know the logic behind. We are fighting a pandemic. We are fighting a disease that really has failed, has made all economies look funny. We are saying, like, if you can, please stay in your house. Stay home as the best answer. As a ministry, we are also trying. That's why I want to take this opportunity to thank our health staff and my colleague, the ministers. I want to thank Honorable Jane Lusacheng, our lead person in the ministry. I also want to thank my colleague Kaduchu. Let me thank the Director General of Health Services, our Permanent Secretary, Dr. Henry Mevesa, Dr. Diana, and many others that the country is looking at us. We should not tire. We should not get tired. For us, we are not going to get tired. The public knows their role. We are also playing our role. And we are saying...
Thank you so much, Honorable Robina Nabanja. She is.
Yes, I'm trying to say that we thank everybody who has contributed to this cause, and we are promising that whatever you have put in our hands will be used to its last penny.
Thank you so much, Honorable Robina Nabanja, the Minister of Health in charge of general duties, as well as the Woman Member of Parliament for Kakumiro District. And I should say that we, as NTV, especially morning at NTV, also have lots of hopes in you, the health officers who are on duty. We believe that you do much in this fight against COVID-19 with guidance of God and everything that is before you. This is Stephen Imbido of FSUA Chibuga, been here in Makere Kavula, the home of Honorable Minister, and now taking you to a short commercial break, and then Rita Kanya will be back with more quality programming, and just wait for this conversation that's coming up with Rita Kanya. I'm out for now. Have a good day.